She is the South African doctor who first discovered the Omicron variant. She has practiced in medicine for many, many years, and I began by thanking her for alerting the world to the fact this variant was there, something I rather wish the Chinese had done all that time ago. Well, I'm very pleased now to be joined all the way from South Africa by Dr. Angelique Coetzee. Welcome to GB News, and can I begin by congratulating you for helping to identify this variant and for warning the world. You've done us all a great service.
Thank you, Nigel. It is a pleasure to be on your show, and I hope I can add some value. Although I doubt that the UK believe us when we say that we have mild disease. But that's what we have.
Well,
yeah,
and this is why talking to you is so important, because the variant's been around for a considerable amount of time in South Africa, and from what I've been looking at and reading, it would appear that deaths of people with COVID are actually falling very, very sharply, and it seems that compared with some of the other variants that we've experienced over the course of the last 20 months, that actually this is a much milder form of COVID-19. Please just tell us what the South African experience has been.
Nigel, yes, you're absolutely correct. We are experiencing it as a much milder form. Remember, we also came out from the Delta wave. Delta is a scary variant. Never ever would I like to be part of any Delta variant mutation going forward. That, it's really scary, and with a very also a very similar or a very confined type of clinical picture. If you have seen a few Delta patients, you pick up the clinical picture and you know the dangers of Delta. So when we first saw the Omicron, we've got a different clinical picture. It's definitely a different clinical picture. It's not the same than Delta. We also was extremely worried. We brought in the same measurements that we would have, or treatment guidelines that we would have done for Delta. And 2 weeks after the first patients that we have seen, we're starting to realize, but this is a mild disease. There's no cytokine storm at primary healthcare level where the majority of patients go and visit with their symptoms. Also, we run a huge campaign out in South Africa trying to explain the symptoms, the clinical symptoms, and urging people to please get tested. So the idea is, because it's a mild disease, it can easily be missed. And if you can get them tested, and you can make the doctors understand, on the other hand, that patient sitting in front of you, who might only come in with a complaint of a slight cold, might be actually your Omicron. You need to get them out of the circulation. You need to get them to isolate, and you need to get quarantined. And then again, we needed to see how much of a cytokine storm we would get going further, which we didn't. And remember the oxygen, with Delta, oxygen is one of your gold standards. And we ran nearly out of oxygen with Delta. And again, with Omicron, there's no oxygen requirements at primary healthcare. I'm not aware of one family practitioner that prescribed oxygen, home oxygen. I can promise you with Delta we did.
So in some ways, could you even argue that if people get this variant and the symptoms are mild, they're actually building up natural immunity with a much lower risk than some of the other variants posed?
No, I think that, it would be safe to say, yes, that might be a possibility. Because again, of the mildness. So interesting enough, the data that we are getting is that the people in ICU with COVID, that's COVID related. We're now not talking about anyone being admitted to hospital and then incidentally got COVID as well. And then, everyone has been told there are so many high COVID positive cases in the hospital, but truth to be told, it's more incidental. So the majority of the patients, that's real COVID patients in ICU. So about 88% of them is unvaccinated. So the vaccines definitely play a role in preventing severe disease. However, with mild disease, we see a 50-50. You know, I've seen you name it and I've seen it. Been having COVID before, not been vaccinated, get reinfected, having had COVID before, vaccinated, fully vaccinated, getting COVID again. Any combination that you can think of, we have seen it.
I mean, we're being encouraged.
Mm.
We're being encouraged to get boosters now. You know, the Prime Minister is turbocharging boosters. I mean, obviously these boosters were designed before the variant came into being. But what would you say to people about getting a booster?
Well, I would say before you get your booster, make sure that all your healthcare workers are at least vaccinated. Make sure that all your vulnerable people has been vaccinated, and then run the campaign with the booster shots, and then you again start with booster shots first for your healthcare workers and your 60 pluses, 50 pluses, people who has immune compromised diseases, people that cannot afford to get any form of COVID, whether it's Omicron or Delta, just to protect them as much as possible. But it's no use running, you know, giving boosters and half of your population or 3/4 or a quarter of your population has not yet been vaccinated. You need to get everyone vaccinated, but simultaneously run a campaign of not mandatory, but let them choose.
And on this particular variant, the Prime Minister at lunchtime has said we must set aside the idea that it's mild. And actually last night, 4 times in an address to the nation, described this as an emergency, taking politics out of it completely. From a medical perspective, does it look to you like the British are overreacting?
Well, they overreact from the moment that South Africa announced that we have Omicron with 30 plus mutations. You know, within 24 hours we got slammed. So, you know, and I would be extremely, it would be very interesting to see whether the British people have a different type of Omicron than the rest of the world, because it doesn't matter how many times we are saying it's a mild disease, it seems to us that some scientists or some people doesn't really want to believe us, you know, and I've even been asked the question, am I not biased because I'm saying it is a mild disease? But go and look at our hospital stats, you know, go and look and you will see that our numbers are not increasing that much anymore. And our infectivity rate was yesterday 28%, but again, normally about 100, between 70,000 and 100,000 people go and test per day. That's quite a lot. And yesterday, only about 60,000 people went for tests. So you have to look at the clinical picture as well.
Well, I'm delighted to hear good news from South Africa, and we are told that it is the South African variant we've got. And thank you for your experience. Thank you for warning the world, which was a great piece of work that you did. And thank you for joining me here on GB News.
Thank you, Nigel. It was just a pleasure. And let's see whether your experience is different than ours.
Well, that was Dr. Angelique Coetzee, and she's chair of the South African Medical Association, making it clear that this is nothing like the Delta variant that went before. It is very mild indeed. And yet, last night, in an address to the nation, the Prime Minister 4 times described this as an emergency.